Death can be messy and maybe not so pretty. Here's what I've seen and how I can help you. So generally speaking, during someone's end-of-life journey, people can have symptoms because of the disease they're dying from. And those things can be the things that cause what we'd say suffering. And those things are pain, shortness of breath, terminal agitation, confusion, kind of an overall chaos because people are not prepared or refuse to become prepared for their end of life. Pain. Pain is not necessarily going to happen just because you're dying. But people who are end of life can have pain because of the disease they're dying from, and certain diseases are more painful than others. There are so many things we can do to help with pain. Pain medication, steroids, distraction, as annoying as that sounds with nerve pain, a lot of times the main thing that can help with nerve pain is distraction. There are other medications we can do for different types of pain like nerve pain. Gabapentin's a good example for a medication you can take that's not a narcotic that can help with something like nerve pain. Now, the hard part of this on hospice is that it's going to go up and down. So let's say you have a pain crisis. Your pain's been managed, all of a sudden it's not managed, you have a pain crisis. Your hospice company is going to come in and they're going to help with that pain crisis. But it takes time. It takes time to get your pain down. They're going to be aggressive, wait for a few hours, see if it helps. Hopefully it does, so then your pain goes down. But if it doesn't go down, they have to come back. Try something else to try to get your pain down. So during that time period, let's say it's a 12-hour time period before they can get your pain controlled, you are going to be in 12 hours of some kind of pain. And that's the not so pretty part of end of life sometimes. That time it takes to get your pain controlled. So people will look at that and of course they're like, we had a horrific time. We couldn't get her pain controlled or his pain, whoever's pain controlled. But we do eventually get it controlled. It just takes some time. So during that time period, what can we do? This is the part that I'm trying to help people understand, that it's not always wrapped up in a pretty little bow. Knowing and expecting that you could have periods of time where your symptoms are trying to get managed is the hard part of end of life. Sometimes it's like that, sometimes it's not. The whole point of this video is to help people understand that when that is happening, it doesn't necessarily mean something's actually wrong. It could just be part of the disease process that we have to work with, and kind of knowing that there will come a time when it will end and it will get back under control will hopefully be helpful. A perfect example of this is someone with terminal agitation. So terminal agitation is something that can happen towards the end of someone's life, usually disease dependent, but sometimes for no reason, people will just be terminally agitated, which usually looks like they're pretty confused. There's no like reasoning with them, and they're trying to get up out of bed all the time, or they're trying to constantly walk around the house, but it's kind of dangerous because they can't really walk, or they're too weak, or we don't know where they're going. So they're just kind of agitated and continuously restless no matter what we do. That would be a time when the hospice company has to come in and try to figure out why they're terminally agitated. Is there pain? Are they holding urine? Do they have urine that they can't get out, that they're retaining? Do we have to put a catheter in? Are they constipated? Is there something, an actual issue causing the agitation? 9 times out of 10, there isn't. And when there isn't, that's when we determine, okay, this is terminal agitation. Not sure why it's happening, but we have to get it under control because we have to keep this patient safe. This is where the hard part for the family comes in, because we're going to start medications to help try to get them not agitated, but it's going to take a while to get the right combination of medications to have that work. So 12-hour period where the family's kind of up, not sleeping, trying to keep their patients safe while we continue to try to titrate, which means increase or decrease certain medications to get this patient not terminally agitated. That's hard. That is hard for the patient, that's hard for the family, and the hospice company is going to try their best to get this patient to calm down. Now, sometimes what happens is we have to give tons of medication to make this person finally relax. Hence why people always think hospice just came in and drugged up my loved one and then they slept until they died. Now that's worst case scenario, but sometimes that is what we have to do because they're either awake and agitated or asleep and not. And sometimes that is the case. We have to medicate until they finally sleep. Now, a lot of times once they sleep, sometimes they'll wake up from that sleep if it's been a good, 8-10 hours, and they'll be less agitated. And then we can slowly start backing off of some of that medication so they can be a little more awake and alert. Sometimes that works, sometimes that doesn't, and we do just have to keep them basically sedated so they can stay safe. Again, that's a not so pretty side of end of life, but that is something that can happen, and please know that the hospice company is basically just trying to make sure your loved one is safe and not suffering, because terminal agitation can feel really uncomfortable for the patient and for the family. Knowing that this is a possibility helps you be more prepared. So this is a similar situation with any of the symptoms I mentioned. So with pain, with shortness of breath, with confusion, basically we're gonna have to titrate medications until this person feels comfortable and is safe. Now, talking about the overall chaotic feeling people can feel at the end of life is usually due to being unprepared. So how do we prepare for someone's end of life or our own end of life so we can relieve that feeling of chaos? Number one thing I think, which is why I'm here, is education. Knowing what to expect, knowing what's normal, what's not normal. And the best way beyond education is just talking about it. Having open dialogue with yourself, with your doctors, with your nurses, with your family about what you're feeling, what you need, how they can help you. Understanding that during the end of life process, your loved one who is dying will change a lot physically, usually, and will need a lot more help. If you're the person who is on this end of life journey, knowing that your life will change, meaning like you won't be able to do all the things you used to do, you won't be able to live super independently, that's difficult. That is difficult to accept. But learning this stuff now will hopefully help you prepare so it won't feel so chaotic when it's happening. Along with that chaos is the chaotic nature of what can happen with the body at the end of life. And one of those things that people forget about is fluids. So urine, stool, fluids coming out of people's mouths, nose. That can be really disturbing and scary for family members who are not used to that. And learning that that's normal can help hopefully decrease some of that fear and disturbance around it. So seeing fluids from your loved one at the end of life is normal due to the relaxation of our sphincters. I think I've talked about this before in other videos, but we have sphincters in our bodies that keep fluid where they should be. So like our stomach has one, and that starts relaxing at the end of life, which can cause regurgitation, which is why you may see like yellow or green or dark fluid coming from your loved one's mouth. Now, not all the time, not always does this happen, but it can happen. So knowing that these messy things can happen in our normal at the end of life will hopefully prepare you a little bit so if you see this, it doesn't totally scare you. At the end of the day, it's just about you being aware that these things can happen. You don't necessarily have to know what to do, but it's just that you know these things can happen. Now, you can call your hospice company. Your hospice company can help you with these things and help you understand why each specific thing that you're seeing is happening and hopefully help with those things. Knowing what could occur can help prepare you for what may happen at the end of life.